An incision is made through the skin and the underlying muscle is divided to gain access to the joint capsule. The joint space is explored, any necrotic tissue is removed, an infection or abnormal fluid is drained. If a foreign body is present, e.g., bullet, nail, gravel, it is exposed and removed. The physician may leave the wound packed open with daily dressing changes to allow for further drainage and secondary healing by granulation. If the incision is repaired, drain tubes may be inserted and the incision is repaired in layers with sutures, staples, and slash or stri strips. A splint may be applied to limit shoulder, elbow, wrist motion. Arthrotomy is performed to determine the type and extent of a growth. The physician makes the incision at the joint line and opens the skin to remove a part of the growth. The incision is often left open to allow for pathology confirmation of the growth's composition and allow for synovectomy if malignant. Once complete, the wound is sutured closed. Arthrotomy, ankle, including exploration, drainage, or removal of foreign body. Arthrotomy, posterior capsular release, ankle, with or without Achilles tendon lengthening. The physician performs an arthrotomy on the ankle for posterior capsular release, with or without Achilles tendon lengthening by making an incision along the Achilles tendon and retracting the muscles to expose the posterior ankle capsule. The capsule is incised to increase dorsiflexion. If the Achilles tendon is lengthened, the physician notches the tendon at the medial and lateral aspects to release contracture. The wound is sutured in layers. Arthrotomy, ankle, with joint exploration, with or without biopsy, with or without removal of loose or foreign body. Arthrotomy, with synovectomy, ankle. An incision is made through the capsule and into the joint. The synovium is removed through the incision. The wound is irrigated with antibiotic solution. The incision is closed in layers with sutures, staples, and slash or stri strips. Arthrotomy, including Tenosynovectomy. To correct thickening of the synovium, the physician makes an incision over the tendon and exposes the tendon sheath. The synovium is the lining that bathes the joint in fluid. The physician removes the affected sheath from the tendon and the joint space is opened and the synovium is removed. The wound is irrigated and closed with sutures. Arthrotomy, glenohumeral joint, including exploration, drainage, or removal of foreign body. Including biopsy. With synovectomy, with or without biopsy. With joint exploration, with or without removal of loose or foreign body. Arthrotomy, elbow, including exploration, drainage, or removal of foreign body. With capsular excision for capsular release. With synovial biopsy only. With joint exploration, with or without biopsy, with or without removal of loose or foreign body. With synovectomy. Arthrotomy, wrist joint, with biopsy. With joint exploration, with or without biopsy, with or without removal of loose or foreign body. With synovectomy. Arthrotomy, acromioclavicular, sternoclavicular joint, including exploration, drainage, or removal of foreign body. Including biopsy and slash or excision of torn cartilage. Arthrotomy sternoclavicular joint, with synovectomy, with or without biopsy. Arthrotomy, hip, with drainage, e.g., infection. Including exploration or removal of loose or foreign body. With biopsy. With synovectomy. Arthrotomy, with exploration, drainage, or removal of foreign body, carpometacarpal joint, metacarpophalangeal joint, each. Interphalangeal joint, each. Arthrotomy with biopsy, carpometacarpal joint, each. Metacarpophalangeal joint, each. Interphalangeal joint, each. Arthrotomy, with exploration, drainage, or removal of loose or foreign body, intertarsal or tarsometatarsal joint, metatarsophalangeal joint, interphalangeal joint. Arthrotomy with biopsy, intertarsal or tarsometatarsal joint, metatarsophalangeal joint, interphalangeal joint. Arthrotomy, with biopsy, sacroiliac joint. Arthrotomy, knee, with exploration, drainage, or removal of foreign body, e.g., infection. With synovial biopsy only. Including joint exploration, biopsy, or removal of loose or foreign bodies. Arthrotomy, with excision of semilunar cartilage, meniscectomy, knee, medial or lateral. Medial and lateral. The physician makes an incision along the anteromedial or anterolateral aspect of the knee, depending on which cartilage is torn. Dissection is carried down to the cartilage. The patella is shifted aside and the knee joint exposed. The torn cartilage is removed and the roughened edges are smoothed. A partial synovectomy and release or excision, partial or total, of plica may be performed. Arthrotomy, with synovectomy, knee, anterior or posterior. Anterior and posterior including popliteal area. The physician makes an anteromedial incision for anterior synovectomy. Once the knee joint is accessed, proliferative, diseased synovium is removed. If posterior synovectomy is required, the physician will position the patient prone and make an S-shaped incision along the popliteal, back of the knee, area. Both anterior and posterior synovectomy is performed Indiana 27335. Dissection exposes the knee joint. Diseased synovium is removed. Incisions are closed with sutures, staples, and slash or stri strips. A temporary drain may be applied. Arthrotomy with open meniscus repair, knee. The physician makes a vertical incision on the medial or lateral joint line area, depending on which meniscus needs repair. The meniscus is exposed and the edges of the tear are debrided with a small curette or scalpel. A rasp abrades the debrided edges of the tear, creating an increased inflammatory healing response. The incision is repaired with sutures and stri strips.